everyone, and welcome to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about dementia change. We will.
Well, hi, everyone, and welcome back to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm thrilled that you can join us today. We're going to be talking about CBD and brain foods, and don't we all want to know about both of those? But before I introduce our guest, I always like to take a minute and just do a couple of shout outs. First, I want to shout out to the Mark Arneson Band for allowing us to use their song Clarion Call for our opening music. And for those of you that are new to our show, Alzheimer Speaks is about sound information, not just sound bites. We like to have real conversations with real people. So maybe, just maybe, you can be our next guest. I also want to direct you to alzheimerspeaks.com. There you can find all kinds of free resources on our free educational resource page. So please check that out. We also do, of course, speaking and training and consulting, helping people with branding in this niche market as well. And don't forget to click on our book tab. Betty the Bald Chicken, Lessons in How to Care is out and available to you now. We're going to hear from the Adaptive Equipment and Caregiving Corner, and we will be right back with our guest.
I love the footbar walker, and let me tell you why. It is the option for my toolbox that I've been waiting for. Let's be honest, there are some clients who, despite our best rehab efforts, just aren't able to return to performing a sit-to-stand transfer on their own. Now I can offer my caregivers an easier, safer option that doesn't involve hoisting their loved one up from a sitting position. I don't recommend this walker for all of my clients, but I do recommend this walker for those caregivers looking for an easier, safer option with transfers. I would also encourage other therapists to add this walker to their toolbox. It's kind of like having my own mobile parallel bars for the client to pull up on. Whether it's a family caregiver at home helping a loved one with Parkinson's or dementia, CNAs in a long-term care facility assisting their patients, or therapists adapting to client and caregiver-specific needs, we now have a very safe and effective option to offer in the footbar walker. Check this product out at thefootbarwalker.com. That's it for today from Adaptive Equipment and Caregiving Corner. Have a great day, and don't forget, if you can't do it, adapt it.
Well, as I said earlier, we're going to be talking about CBD and brain food with a gal who's been on our show before. Her name is Ali Stoddard, and she has deep experience with cannabinoid medicine, orthopedics, pain management, and nutrition. She's going to, again, be discussing the benefits of CBD and other brain foods on our show today. Well, Ali, I'm so excited to have you back on the show. So thanks for taking time to be with us today.
Thank you so much for having me. I'm very excited.
Well, some of our listeners might not have remembered your history with dementia, if you've had one or not. So I always ask every guest if they've been personally touched in their own family or circle of friends by dementia.
Yes. In fact, my mom has dementia. She's 89. And for the last year or two, it's been progressing myself too. I mean, I'm 61 and I feel that I forget things. So I think it's a very important topic.
For sure. I'm 63 and I know my brain doesn't tick like it used to. That's for sure.
Yes.
And it's trying to figure out that balance with everything. So thanks for sharing that. Why don't we start out with what exactly is CBD? What does it even stand for? And how did you get involved working with it?
Well, thank you. Yes. So CBD is, we call it CBD because it's actually, the scientific name is cannabidiol. It's a big old word. Canna is in that word, and cannabis. And there's a whole branch of cannabinoid molecules in the system and in pharmaceuticals. So CBD, actually, this molecule comes from a plant. But interestingly enough, we also produce this very similar molecule in our body. So yes, CBD comes from the plant, but we also produce CBD in our body. And that's why it's such a natural superfood supplement drug for us to take without the side effects of a man-made chemical.
Well, interesting. I always knew it was a plant, but I guess it didn't register with me that we had that in our body as well. So that's kind of neat to hear. How does it work and why does it work for so many people?
Right. So we make the CBD from a system in our body called the endocannabinoid system. Endo meaning within. We make cannabinoids within our own body. And this system was only discovered in the 90s. Dr. Meshulam in the 1960s discovered that there's this molecule in the pot plant called THC. And from there in the 90s, they discovered this whole receptor system. It's almost like we have an immune system, we have a respiratory system. Well, we have an endocannabinoid system that's actually the biggest system in the body. It's the most pervasive system. And this endocannabinoid system produces cannabinoids like CBD and THC. And there are other cannabinoids too. But this system is not being taught in our medical schools because our medical schools are driven by the pharmaceutical companies. And this is a plant, and you cannot patent a plant.
Oh, interesting. Now, I've heard so many people talk about CBD for so many different ailments. I know I use it when I'm stiff and sore and achy. And boy, it loosens up my neck and my shoulders really, really quickly and stuff. How can this be used?
Like, how can that be? Like, ADHD, anxiety, depression, PTSD, chronic pain, Alzheimer's, because of this endocannabinoid system, this system that I was talking about. It's a system of receptors, pathways, ligands. For instance, we have an endocannabinoid receptor in every single organ in our body. So our skin has receptors. So when you use a CBD topical, like a cream on your neck, it gets into the CBD receptors immediately. Whereas when I was with the pharmacy, we were doing pharmaceutical compounds with big bad, different types of muscle relaxants, ketamine, baclofen, gabapentin. We were putting those in our topicals. We always had to figure out how we were going to drive those man-made chemicals below the skin's surface because there were no opioid receptors in the skin. Well, we have endocannabinoid receptors or CBD receptors in the skin. So it works very quickly on the skin. Even if you were to put it in a joint like on your hip, it's going to penetrate into the hip joint very quickly and easily because of these receptors on the skin.
Yeah, I was always fascinated how quick it worked. It was like, how can that be? I was kind of like looking around for someone with a magic wand or something, because it was just really instant relief, for me. And like I said, I primarily use it, for muscle pain, when I'm stressed and things like that, or, pull my back out every once in a while. But, I hear a lot of people using it just to feel more relaxed and comfortable. And I know there's lots of different ways that you can also take CBD. So I use the cream, but I've heard other people with oils and tinctures and gummies. And how are all those? How do those different ways process within the body? Are they slower or faster, or all kind of the same?
Great question. So, for instance, we've got CBD topicals like creams and balms and sprays, and they go on the skin. So they work by going on the skin and into the localized place. but not a lot of that CBD gets into the bloodstream. So when we use an ingestible like a capsule, a gummy, or a tincture, which is actually a CBD oil that you put under the tongue and you hold it for 2 minutes, gets into the bloodstream through the capillaries under the tongue. So when we use an ingestible, the CBD gets into the bloodstream and jumpstarts this whole endocannabinoid system. So when we have CBD in the bloodstream, then the body knows what to do with the CBD. When you bring CBD in, our endocannabinoid system knows, hey, the brain is on fire. We've got a lot of neurotoxicity going on. Let's quell the anxiety. Or, hey, we just got an injury in the elbow. The biggest inflammatory site is the elbow. Bring the cytokine storm to the elbow so we can attack or help that inflammation. So our body knows what to do with CBD. Now, if you've got chronic pain or a chronic condition, Alzheimer's, dementia, anxiety, depression, on a 24-hour basis, then you want to take an ingestible. So I always start off with a tincture, which is the CBD oil under the tongue, so we can dose correctly. And some people who are highly sensitive can only use, say, 1 drop under the tongue once a day, whereas other people who metabolize differently have a more robust endocannabinoid system. They can take 10 or 15 milligrams twice a day. So every person, their system is different. All the drugs on board. So we take all of that into account when we say, hey, let's start an ingestible or let's start out with a topical. And if you've got pain, a topical is always the easiest to start out with, put it on your neck. But if you've got chronic pain and you're getting up in the middle of the night because of pain, then you're going to want to take an ingestible like a CBD tincture or a capsule or even a gummy. I know everybody loves gummies, so I actually have a gummy that has no high fructose corn syrup in it. So, yeah.
Well, it's interesting because I know with the tinctures, I've had a few friends who have used those, and they were surprised at how customized they could get with their dosage in terms of consulting like with you or someone else in terms of what's the right dose, because like you said, what's good for their friend or the family member might not be good for them to be able to do. So I personally think it's nice to get those consultations and to work with somebody on that versus doing your own personal guessing game.
Absolutely. It's such an important question and issue because a lot of our clients are going to a dispensary and the dispensary is going to say, well, this is good for pain. And they'll give you something with 15 milligrams of CBD, but it's also going to have 15 milligrams of THC. So the difference is when you go to a dispensary, you're not getting somebody who's got a medical background, A, and B, you're getting a product that by law has to have THC in it. And that THC can make you paranoid, can make you dizzy, can make you high. So everything that I have on my website, greenalleycbd.com, is hemp derived, which means there's 0.3% or less THC, not enough to get you high or dizzy. And yet it has the main cannabinoid CBD that jumpstarts this endocannabinoid system. So it's all the dispensaries and the deliveries, they're the ones doing all the marketing. But, they don't have the medical background. So I think that's extremely important.
Well, and with a person with dementia, a lot of times they can get paranoid. They can have hallucinations, and that's what we're trying to avoid. So you don't want to be adding to that. So it's really important to know those factors. I mean, I know there's a lot of medications out there that are still prescribed by doctors that, others will say, no, you never give this to a person with Lewy body dementia. Never, 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 because it's going to make it worse, or frontal temporal. And you need to have somebody who knows the specifics of the disease, what the symptoms are, what are you in total trying to kind of control or reverse, and get rid of there. So that makes a lot of sense. In terms of consultation, how does somebody do that with you? Do they go through your website or call you or?
It's funny. I don't even have a consultation tab on my website, but yes, give me a call. Go on my website. You can email me. My phone number is on my website, 925-899-4539, literally, and text me or call me and we'll set up an appointment, because I do like to do a health intake, figure out what drugs you're on, figure out what symptoms, what diagnoses you have, how sensitive you are to drugs or foods. And then we go from there. As I said, some of my clients can handle one drop of this beta-caryophyllene that Dr. Blair has produced that will jumpstart the endocannabinoid system, and other people have to use it topically. So we're all different, and it needs a little bit of consult to figure that out. But literally everybody has an endocannabinoid system. And if your CBD isn't working for you, 2 reasons: you have the wrong product, or your endocannabinoid system needs to be jump-started. It needs to be awakened. And with many disease states, and most likely including Alzheimer's, that endocannabinoid system is usually not working. It's usually one of the first systems to shut down. And the body has many checks and balances, and we don't realize the endocannabinoid system isn't working until we get to a certain point of high toxicity and high symptomology, and we can't handle things anymore.
Okay, let me ask you this, because some of our audience is probably thinking, Ali, what's your background in terms of doing a consultation? How did you get into this? Where's your knowledge base from?
Great question. I have not one single degree. I graduated from Cal with an environmental science degree because I didn't have to take organic chemistry, and now I'm working with organic chemistry. So my background, 25 years in the operating room, working with physicians and surgeons as a consultant for orthopedics, brain surgery, oncology. I learned a lot about osteoporosis, and I worked with a lot of seniors with vertebral compression fractures. And then I had my own pain management company distributorship, where I was working with the compounding pharmacy with topical pain creams and wound care solutions. And in 2015, I said, there's got to be something better than surgery and pharmaceuticals. Those are the 2 tools in our Western doctor's tool belt. And that's when I found the plant and started to do tons and tons of research on my own. There's tons of research on PubMed, which is our repository for clinical studies. And I've done probably 2,000 hours of nutrition and cannabinoid medicine. I've worked with the plant since 2015. And back then, physicians were not allowed to talk about cannabis or even tell anybody about it. And so I was able to work with many, many clients in many different types of scenarios. And so my experience is really in the trenches. I've been able to touch the plant and touch the patient, whereas physicians have not been able to do that. So my background is I continuously do research. I follow many holistic health practitioners, Mark Hyman, David Perlmutter, Dr. Philip Blair is the most experienced CBD doctor in the world. And I work with him. And if I have something very complicated and we can't figure it out between my business partner, Holly Reese, and myself, we send it to Dr. Blair. But I always can consult with him as well. And he's got just a broad range of CBD experience. But I bring more nutritional, I bring more the holistic side to him, actually, to his practice. And so we're a good complement.
Good. Yeah, I've worked with him in the past as well. Super nice guy. The book he has out, I mean, if you question his knowledge on all of this stuff, it's overwhelming to the layperson. But he really, he really does a nice job in terms of laying things out and explaining things. So it's nice that you've got a close working relationship with him. Like you said, when he's one of the renowned doctors in the I believe not just in the U.S. but around the world,
Around the world.
In this area.
Yeah, absolutely. And if you go on YouTube, you can Google Philip Blair, MD, CBD, and he's got over 70 videos that are very, some are good for doctors, but some are good. Most of them are good for the layperson. So if you have any clients out there, patients who want to learn more about CBD, he's got a lot of them. I've got a lot of education on my website as well. He discusses a lot more of the science. I try not to get too deep into that because it's very complicated and I tend to lose people.
Yep. Well, it is complicated, and I've watched a few of his, and there was a couple of them that just made sense. Like when I would read it, it was like, oh my gosh, I'm in the weeds. I don't know where I'm at. I don't know what's connected to what. But then when I got to see the visuals of it, then it like made sense to me. And I'm like, oh, okay, I can breathe again. Now I'm tracking what he's saying and stuff. But yeah, even like when you were talking about putting the cream on that's inside our body, it's almost like there's this little army that says, okay, we know where to go. We've got the plan. So you don't even have to tell us. We just know by how the body is working where to take this to do good. And that's my simple breaking it down,
Absolutely.
But go ahead.
The other part of that is these endocannabinoid receptors and the endocannabinoid system. When you're talking about opiates, for instance, for pain, the opiates go from the presynaptic to the postsynaptic. So the pathway is very similar for most pharmaceuticals. Well, the pathway for the endocannabinoid system is actually opposite of that. It's in a retrograde fashion, which means it goes from the post to the pre. So because of that, we're working in different pathways. We don't see drug-to-drug interactions. We have these endocannabinoid receptors all throughout the body. In fact, there are more receptors in the brain than all of our other brain receptors combined. So our bodies are meant to bring this plant in to help with pain, anxiety, depression, inflammation, blood pressure. I've reversed somebody's PTSD. I got a Vietnam vet off of 100% of his meds within 6 months. I've gotten a 17-year-old off of 3 of her anti-anxiety drugs within 3 months, cold turkey. We had a Alzheimer's patients in a assisted living, very aggressive, very vehement, very, she started getting very loud, and it wasn't her. That wasn't her personality. Once we got CBD on board, she calmed down and she was back to her old self. So we can see many different differences in our mood, in our reactions, in our ability to handle stress, and in our pain response. It's huge.
Well, and it's, especially for a person with dementia, when they get labeled aggressive, it can be really difficult to find placement for them. So getting that under control before a major episode is really important to be able to do. And a lot of times you don't know you're going to have a major episode, just like you don't know if someone's going to wander off and get lost till they wander off and get lost, but usually with aggression, there are signs, precursors, that something's up, and that they're agitated, they're not feeling comfortable. And, instead of ignoring it, you got to address it in one fashion or another. Yeah. If you're just tuning in, we are talking with Ali Stoddard, who is with Green Alley, CBD Health and Wellness Company. And she's just a wealth of information. And we are going to continue our conversation here. But you can also, hop on her website. She has two, greenalleycbd.com and greenalleywellness.com. And Ali, what's the difference between the two websites? What will they find in terms of what they go to either one?
There's two different URLs, only because it's the same website, same exact website.
Okay.
My credit card processing doesn't want to see CBD in the URL, which is like ridiculous because CBD has been federally legal since 2018. But that's the way it is. So, the homeopathy, plant medicine, and cannabidiol CBD has been really censored. The dispensaries get more, freeway than I do, which is very interesting. But it is what it is.
Wow, that is interesting. That is interesting.
Yeah, I've been shut down by Facebook, PayPal, Venmo, YouTube, just for talking about hemp.
Really?
Yeah.
Wow.
I don't get it either, but it's federally legal. It's a dietary supplement. You can't get high. All it does is boost the immune system, help strengthen our systems in our body, so we can work better. It's we live in an interesting world.
That's for sure. Well, let's talk about hypersensitivity. Can that help folks struggling with that too? And on what types of because there's all different types of, there's all different things you can be hypersensitive to. I'll put it that way.
Yes. So, whether it's a sensory sensitivity, a pharmaceutical, a food sensitivity, we've got clients with this thing called Ehlers-Danlos, which is hyper response in the joints. So whatever sensitivity it is, Dr. Blair developed a product called BCP, or beta-caryophyllene, and we've been using that for these patients who are highly sensitive. What's happening is the amount of toxins in the body has gotten too high, whether it's neurotoxicity from what we're eating or from chemicals or just a blip on our DNA. So the beta-caryophyllene is a plant nutrient that you actually find in cannabis, but you find in hops and many other plants. And he has concentrated it. We've found that the beta-caryophyllene jumpstarts or awakens this endocannabinoid system. So if you're very sensitive, most likely this system is not working. So we use the beta-caryophyllene to awaken that system very slowly. Takes, sometimes days to weeks. And then we can introduce CBD and it can be used. Sometimes BCP, beta-caryophyllene, works just by itself. Really cool. Yeah, we're learning so much, especially in the last 3 years. We've, the amount of endocannabinoid studies in CBD has quadrupled. In 2015, when I started, there were 28,000 studies. Today, I don't know how many, but if you go in and look at, just for instance, anxiety and CBD, there's over 500 clinical studies done. And if you look at Adderall, which is one of the most prescribed medicines, back in 2015, there were 176 versus thousands. So the cannabis plant has been studied ad nauseum by the U.S. government to find a bad benefit. In other words, they wanted to find what are the horrific side effects of cannabis, and they couldn't find any. Phlegm. They couldn't find any, even with smoking pot. And it's because we have this endocannabinoid system that's using the THC and the CBD to do things. But what they have found in the last 5 years is it's really the CBD molecule that turns on, turns off these gene expressions, and THC works a little bit differently. It doesn't jumpstart the system. In fact, I tell the the kids who all want to get out of their bodies. They're so full of anxiety. They smoke pot and they want to get out of their bodies. And that's what pot does. It gets you out of your body. Well, CBD gets you in your body, and it makes you feel grounded, and you feel focused, and you feel calm. You don't feel reactionary. When you have THC, it sometimes makes you paranoid and anxious.
Mm-hmm.
So we never want that. So that's why CBD from the hemp plant, you have to get online. You cannot get that at the dispensary. They are not allowed to sell CBD hemp.
That's interesting.
Isn't it crazy?
Yeah. It really is. It really is kind of nuts. Do you work much like with kids with autism? I just think of hypersensitivity with them is kind of off the chart.
Very much so. Many kids with autism. And again, when we have a problem in the brain, whether it's autism or Alzheimer's, the other things we got to look at are, let's support the brain with brain food. Now, CBD is an excellent brain food because children with autism and Alzheimer's patients, they have the same anxiety, right? And so what the endocannabinoid system does is it relaxes, or it doesn't relax, it actually stops the neurons in the deep brain from overfiring. And so when we overfire, we get anxiety, we get panic attacks. And so for these kids who have autism, we've seen their executive function increase. We've seen their reactions be calmer. A kid hits them in the one kid I have, he's going to school. If a kid hit him, he'd hit him back. And, after about 3 months on CBD, and it took us a little while to figure out how much, what he needs. But literally he said, "Hey, I don't like that." He didn't yell at the kid. He didn't hit him back. And we're like, oh my gosh, this is something,
That's huge. Yeah.
It's beautiful when you see it in kids because they don't have the tools that adults do, to figure out what to do. They just react. And so you see it right away. And you see it also with patients with dementia. They as well. And so when you see those reactions calm down and the joie de vivre comes back, it's incredible. My 17-year-old kid that I got off of 3 of her drugs, one which was Seroquel, which is a horrible drug. When I talked to her over the phone, it was like she had a lobotomy. She had no tonal difference in her voice. She didn't have any response to any of the questions. It was like she was just like, ugh. And then a month later, when I talked to her, her voice was full of joy. I mean, you could just hear it in her voice. And so, these patients, they get their joie de vivre back. And that's so important.
Well, it is important. And we all know, like if you're in the dementia circle, we know that stress, any type of stress, increases symptoms. And my guess is that it happens for a lot of diseases. When we're stressed out, things just get worse because, stress is attacking our body. We've got less to fight off, and, things aren't communicating as well within. I would imagine with like ADHD too, we always refer to that as kids, but we got a lot of adults walking around with that too. That started that whole trend.
Yes. And so I'm going to get back to the brain foods because this is important. ADHD, anxiety, Alzheimer's, brain issues, even chronic pain. We've got to get more omega-3s in the body. That's fish oil. There's a specific fish oil called DHA and EPA. And our brains are comprised of DHA. Our brains are comprised of omega-3s. And today's diet, Western American diet, is full of omega-6s. They're putting these vegetable oils in everything, your whole wheat grain bread, your hummus, all of these things that we think are healthy are no longer healthy because they've got omega-6s from the vegetable oil, which means that we get too much omega-6s, we can't absorb the omega-3s that are our brain food. So all of our Alzheimer's patients, dementia, chronic pain, ADHD, all of those patients should be on omega-3s. And the specific ones are DHA and EPA. And so I talk about omega-3s, vitamin D3 plus K2, and CBD. All three of these really superfoods reduce inflammation. And with Alzheimer's, we know it's not the amyloid plaque. The amyloid plaque is the Band-Aid that the body puts there to protect the nerve. It's inflammation. So if we can stop the inflammation on a daily basis, we can help calm the nervous system even without CBD. So I always have my clients take a gut test. We figure out what inflammation is coming into their bodies on a daily basis, and we avoid those foods. And then we bring in omega-3s, vitamin D, and CBD.
Interesting. For a consultation like that and a gut test, what does something like that run?
So I don't do the gut test. A company called Viome, V as in Victor, IOME.com. They have a gut intelligence test, and I have found that's the best test. And they give a whole report, and then I charge $80 an hour for a client, and we'll go through the test. We'll go through their health history, and I will customize a program for that client. And, you know, the gut talks to the brain. If we have gut issues, we're going to have brain issues. If we have brain issues, we're going to have gut issues. This vagus nerve is connected to the brain, to the stomach, and it goes all around our immune cells. So what we eat is very important to the brain.
Okay. And, you know, we've heard that for years, but we still don't listen because it's so easy to run through McDonald's and, you know, and everything's gotten, you know, upsized and upsized, you know, I mean, everything's just huge nowadays, you know, that we get. And like you said, it's kind of drenched in oils and stuff. But our fast paced life, that's just what's become the norm for so many families out there. What about worrying about drug interactions, you know, using CBD? Because I know that's something everyone is conscious of, you know, drug interactions with anything. What do they have to think about with CBD, or should they be aware of?
Well, the beautiful thing about CBD is it's used in a retrograde fashion. The pathways are very different. We don't see drug-to-drug interactions. I mean, that's why I was able to get this 17-year-old off of 3 anti-anxiety drugs with cold turkey. We don't see drug-to-drug interactions, but we do see problems with hypersensitivity. But if we see a problem with CBD, it's usually because the endocannabinoid system isn't working.
Mm-hmm.
So we'll jumpstart it. We'll get it working, and then we'll introduce CBD again.
So in terms of, you've mentioned jump starting, how do you do that? Is that through foods, or is that through using the CBD, or how does that look like?
So it's this beautiful product that Dr. Blair started. It's called beta-caryophyllene. It's not a CBD or a THC. It's a plant nutrient. And we'll start with literally 1 drop of BCP. And that will start the receptors to start growing. It'll waken up this whole system that's there. It just hasn't been used.
Okay.
So, yeah, really slowly. And sometimes every once in a while, I'll get somebody, we'll put 1 drop in an 8-ounce glass of water, drink half the water, you know, one day, the other half the next day. So we can start to introduce BCP slowly and awaken the system.
Okay.
Cool. It's very, very interesting, but it's all plant stuff. So that's the neat thing about it. If it comes from a plant, our bodies are wired to bring in plant medicine much easier, much gentler than, say, a man-made chemical.
Mm-hmm. Okay. As far as foods to eat, if you had to recommend 4 foods that people typically aren't eating, what would they be?
extra virgin olive oil from Amphora Nueva.
Mm-hmm.
They're the number one. Dr. Bredesen out here in San Francisco is using just their olive oil to help treat Alzheimer's. It's a
Okay.
highly anti-inflammatory. It's got these things called polyphenols, which also CBD has. So Amphora, AMPHORANUEV as in Victor A.com. And they've asked for the highest polyphenol count. That's what you want. So that's number one. Omega-3 fish oil, DHA plus EPA. Those two omega-3 fatty acids are the ones that have been proven to help the brain. The brain is made of DHA. So fish oil, which I also have on my website. And then vitamin D3 plus vitamin K2, high correlation with inflammation and vitamin D deficiency. In fact, when COVID hit 3 years ago, there were 3 international studies showing those who got infected with COVID and had the worst outcomes had a vitamin D level of 40 and below.
Mm-hmm.
This country, our doctors think 40 is perfect. Well, in Europe and in Canada, it's 100 to 150. My vitamin D blood level is 115. I'm out in the sun all the time. 15 years ago, my blood level was 21, which would have put me at risk for COVID. So a vitamin D level vitamin D is another superfood to vitamin, but really they think it's a hormone that reduces inflammation. Omega-3s reduce inflammation. CBD, reduce inflammation. So we've got olive oil, omega-3s. Nutritional yeast is a wonderful supplement. It has a whole complement of B vitamins, which are very important for the brain, very important for anxiety, very important for chronic pain. So nutritional yeast is a beautiful supplement. It's a vitamin B. So it's a kind of like a powder, kind of tastes like a little kind of like cheesy. Let's see. And another one, my favorite for mineral salts is juicing celery. And I know a lot of people won't go out and get a juicer and juice celery, but another one is mushrooms. Mushrooms are excellent for repopulating our gut with good bacteria. And if we have good bacteria in our gut, then the gut is going to be talking to the brain and saying, hey, we're okay. But if the gut is always on fire with inflammation, we're getting neurotoxicity straight to the brain. So what we eat is definitely important. And of course, pesticides. Glyphosates are becoming our number one problem. That's the Roundup. That's the chemical that's in all the pesticides. So eating organic is really very important. Great websites out there, EWG and CEH. Both of those websites will tell you, just Google the Dirty Dozen or the Clean 15, and they'll tell you all the produce that's clean, that you can eat non-organic, and then the Dirty Dozen are the ones that you absolutely have to eat only organically. Like if you're going to eat an apple or a strawberry, if it's not organic, don't eat it. Literally don't eat it.
Wow. Well, and I've heard, just on the news recently too, there was a story about someone who was packaging something as organic and it wasn't organic too. And so that stuff is out there. I mean, there's scammers in every area.
Yeah, we had a restaurant in the Bay Area go out of business because they kept saying they had grass-fed, grass-finished, which is also what you're looking for, grass-finished, not just grass-fed now, beef, and they weren't grass-fed or grass-finished. They weren't even organic. And so unfortunately, there's not a lot of oversight. And that's why I started my website as well. I'm online and I ship all over the country because I want my clients to be able to know that when they come here, they're going to get excellent dietary supplements from Designs for Health, and they're going to get CBD and products like Dr. Blair's beta caryophyllene. I think three other companies in the world sell this stuff.
Mm-hmm. Okay, well, that's good. That's good to know. Is there anything that we haven't covered that we should have so far?
Let's see. Yes, the best forms to take.
Mhm.
So do I start out with a gummy? Everybody wants to start out with a gummy or a capsule or a tincture. Or can I do a cream? So if you've got pain, try the cream first. That's a topical. It's easy. $40. It's not so bad. There's a $12 one. Just try it. If you think it's working and, I feel a difference, but gosh, I'd like to get, 80% better versus 20% better, then go with an ingestible like a tincture or a capsule or a gummy. Now, that said, when you take in a capsule or a gummy, now we've got to digest it. So if you've got poor digestion, you're going to get, maybe 10% of the medicine in the bloodstream. So if you've got hypersensitivities or you're a little worried, then start with a tincture. So we can start you with, say, 1 drop under the tongue and hold it under your tongue and then feel the difference in 5 to 10 minutes. So I like to try with a tincture first. That's something that goes through the bloodstream. It's very quick onset, and we can dose it up or down very easily. So the tinctures tend to be quick and most efficient. But once you know what it feels like to be out of pain or to be out of anxiety, then you can go to a capsule or even a gummy. But some people go, I think it's working. I'm like, well, if you think it's working, then double your dose, literally, because you should know it's working.
Okay. Well, and the nice thing too with a tincture cream, especially for someone with dementia, is pills sometimes can be tough, to get them to swallow and things. So that's a nice option.
Yeah.
Well, I guess I just like to say again, thank you for sharing all this great information with us, Ali. This has been wonderful, and I would love our audience, to like, click, and share. Not for Alzheimer's Speaks, but because this is information that people are talking about all the time, but they don't know where to go. They don't know where to find help. So, let them know it's accessible. There's consultations. There's, you have a question, they'll answer it for you, and if Ali doesn't know, she'll tap into Dr. Blair, who, is renowned throughout the world on this and get you your answer. But, there's hope out there. And again, it's not going to be for everybody, just like nothing's for everybody, but it is another option out there that people want to explore. And I'm a girl of options. I want my options so that I can make my own choices. And I think that is really, really important. So, be a giver of hope, just like, click, and share. It'll only take you a few seconds. You might have a lot of people in your own family or circle of friends that are dealing with pain or some form of disease that they just have never told you about, because people don't like talking about those things, and yet they're suffering. And, if we can help them not suffer, I think that's a good thing. If we can give them another option to look at, I think that's a good thing. So you can get a hold of Ali. Again, you can contact her by phone, 925-899-4539. And you had said earlier, you respond better probably to calls and texts versus emails. Is that correct?
Yeah.
A lot of people like that too. They like to talk to a real person, or, the younger generation likes to text. My daughter barely answers her phone. It's just thumbs up, when it comes to something. But you can also email at askgreenalley@gmail.com, or you can go to either of the websites, greenalleycbd.com or greenalleywellness.com. Again, they're going to direct you to the same site. And I found that fascinating, why you had to have two sites for that. She is also on Facebook as Allison.P, and then last name is Stoddard. You can also find Green Alley on Facebook. On YouTube, and you are also on Instagram as Green Alley CBD. You're on personally on LinkedIn, and also on Twitter as Ali Stoddard 1. So lots of ways to be able to reach out and get information. So again, thank you so much for joining us today, Ali. I really appreciate it.
Well, thank you for this opportunity to educate. I love to educate, and anybody wants me to come out and give a talk anywhere. You got 5 people, I'll give a talk. I'm very passionate about it. And Green Alley, Alley, by the way. I'm taking cannabis out of the back alley and turning it into a green oasis of healing.
Okay. Well, thank you. We'll talk to you all soon. And again, if you have questions regarding Alzheimer Speaks, just go to alzheimerspeaks.com. Check out our book, Betty the Bald Chicken, Lessons in How to Care. And also you can tap into all those free resources as well. So take care, everyone. Bye now. Well, hi, I'm Lori LeBay, and I wanted to tell you about Alzheimer Speaks, which is another great podcast. You see, my own mother lived with dementia for 30 years, and I felt lost. Did you know every 3 seconds someone in the world is being diagnosed with dementia? Odds are it's going to hit your families too. We want to help you connect to services, products, tools, research, and stories so you can be prepared. Please subscribe to Alzheimer Speaks on your favorite podcast platform.